Major depression is persistent feelings of depression that last throughout the day for weeks. It's the inability for that person to pull themselves out of a state of hopelessness. You see a lot of people with intense feelings of suicide and giving up, which is much different than someone who's experiencing depression where maybe they have episodic feelings of sadness. So you can see major depression co-occurring with substance abuse disorders. You may see it with anxiety disorders. So it's common that there's more than one disorder going on. Oftentimes people may think that someone suffering from major depression may be just lazy, that they're putting on an act, or that if they leave them alone, maybe they'll get better, or that it's something they can just suddenly come out of. And the reality is that is not true. People suffering with major depressive disorder have a real mental health disorder that need professional help. So the first one a family member or loved one can do with someone experiencing major depression is engage them in a conversation, asking them how they're feeling, ask them what's going on, encourage them to get to a mental health provider, talk to them about suicide. Don't be afraid to talk to them about a plan for safety. Just because you have a conversation about suicide does not increase their risk for doing self-harm. Quite the opposite, being open with them, allowing them to talk about their feelings, helping normalize some of these and helping encourage them to seek mental health care could potentially save their life. It's very important for people who have also identified that they've already have major depressive disorder to be aware that there are triggers that make them vulnerable to relapse, and those are things like stressors in daily lives, loss of a loved one, job stressors, any changes in life, and to really be aware of how they're feeling, to be aware of differences in their ability to function. The evidence-based treatments that are most effective for major depression involve a combination of medications and therapy, and those could be therapies based in thinking and perception, based around development of positive coping skills and maintaining a decreased stress level. Both the Tallahassee Memorial Behavioral Health Center and the Apalachee Center provide inpatient mental health services as well as outpatient services for someone suffering from major depression.